Ms. Rodriguez? Hi, how are you doing today?
Hola, ¿hablas español? Necesito a alguien que me ayude. Tengo un dolor de muela y necesito una limpieza.
The BCC Dental Hygiene class of 2008 has designed this video to help our fellow students when treating the Spanish-speaking patient. This video will go over conversational Spanish as well as common dental terms. We will also discuss what not to do when treating the Spanish-speaking patient. Please feel free at any time during this video to rewind for repetition. Thank you, and we hope you enjoy.
Now we're going to review some basic conversational words.
Okay, Jenny. So to begin, you would want to say hello by saying hola, and then you can say good day by saying buenos días. So do you want to go ahead and try that?
Sure. Hola. Buenos días.
Good. Next, what you want to do is introduce yourself by telling them your name. So you would want to say, mi nombre es. So to introduce yourself, you're going to want to say, mi nombre es, and then say your name. So do you want to go ahead and try that?
Sure. Mi nombre es Jenny.
Very good. After you introduce yourself, then you can ask them how they're doing. So you can do this by saying, ¿Cómo está? You want to try saying that?
¿Cómo está?
Good. They're probably going to answer you by saying bien, which means good. And if they ask you, ¿y usted? That means, how are you doing? And you can respond by saying bien and then gracias, which means good, thank you. So you want to go ahead and try that?
Bien, gracias.
Good. So let's try again from the beginning. Go ahead and introduce yourself and we'll have a conversation.
Mi nombre es Jenny. ¿Cómo está?
Muy bien, gracias. ¿Y usted?
Bien, gracias.
Good. Okay, so now after you've introduced yourself, you want to let them know that you only speak a little bit of Spanish. Otherwise, they might try to have a conversation with you. So what you want to do is say, hablo un poco de español. You can even hold your hand up like this. Un poco de español. So do you want to try saying that?
Sure. Hablo un poco de español.
Perfect. After that, you want them to follow you into their operatory. So what you can do is say, siga, por favor. Now, por favor means please. So follow me, please. You want to try saying that?
Siga, por favor.
Very good. The two most important terms to remember are please and thank you. That is por favor, which means please, and gracias, which means thank you. So once you get the patient in your operatory, you can tell them to sit down in the chair. To say that, you would say, siéntase aquí, por favor. You want to try saying that?
Siéntase aquí, por favor.
Very good. So now, Jenny, do you want to try practicing having a conversation with the patient?
Sure.
So you can be the dental hygienist and I'll be the patient. So we'll see how this goes. Okay.
Hola. Mi nombre es Jenny. ¿Cómo estás?
Muy bien, gracias. ¿Y usted?
Gracias. Hi, girl.
You can say muy bien, gracias.
Muy bien, gracias.
Good.
Hablo un poquito de español. Siga, por favor.
Okay. And so then I'll walk to the operatory, and once I get there, remember how to tell me to sit down?
Siéntese aquí, por favor.
Really good. So remember, we're not going to get it perfect at first, but with practice and time, we'll get good. So let's try doing a demonstration again with how to talk to a patient in Spanish.
Ms. Rodriguez? Hola, buenos días. Mi nombre es Jenny. ¿Cómo estás?
Bien, ¿y usted?
Bien, gracias. Hablo un poco de español.
¡Ay, qué bueno!
Siga, por favor.
Action.
Siéntese aquí, por favor.
¿Cómo no? Now we're going to discuss basic dental terms in Spanish.
go over some anatomy terms. The head is la cabeza.
La cabeza.
Good. Now the mouth is la boca.
La boca.
Very good. Now the teeth are los dientes.
Los dientes.
Very good. And the gums are las encías.
Las encías.
Very good. Now we're going to use the words that we just learned to use basic commands in the dental chair. So first of all, you can tell them to move their head by saying mueva la cabeza.
Mueva la cabeza.
Good. And then you can just move their head where you need them to move it. The most important phrase that you need to learn is to tell them to open their mouth. And you say that by saying abre la boca.
Abre la boca.
Good. And if you want them to open wider, you would say más grande.
Más grande.
Very good. Now, if you want to see if they have some sort of pain in one of their teeth, you can use the question, do you have a pain in your teeth? And you would say that by saying, ¿Tienes algún dolor en los dientes?
¿Tienes algún dolor en los dientes?
Good. They can either respond by saying sí, which means yes, and no, which obviously means no. If they say sí, you can ask them where by saying ¿Dónde?
¿Dónde?
Good. And at that point, they can point to where they have the pain. So let's practice these three phrases again. Mueva la cabeza.
Mueva la cabeza.
Abre la boca.
Abre la boca.
Más grande.
Más grande.
¿Tienes algún dolor en los dientes?
¿Tienes algún dolor en los dientes?
¿Dónde?
¿Dónde?
Very good, Jenny. Now we're going to have a demonstration using the common dental terms that we just learned.
¿Tienes algún dolor en los dientes?
Sí,
¿Dónde?
aquí en esta muela.
Mueve la cabeza, por favor. Abre la boca. ¿Más grande? Bien, bien.
There's some things you want to avoid when communicating with somebody that doesn't speak the same language. For example, some tend to speak abnormally loud. This is a demonstration of what not to do.
Miss Rodriguez? Hi, how you doing today?
Hola, ¿cómo estás?
My name is Jenny. Follow me.
Although gestures are essential for communication, exaggerated gestures may be offensive. This is another demonstration of what not to do.
Okay, Miss Rodriguez, we're going to start the cleaning. Turn your head and open your mouth.
It's okay to use English and Spanish words when trying to communicate with a Spanish-speaking patient. You want to try to avoid mixing the two together, because this might be offensive. This is another demonstration of what not to do.
Okay, Miss Rodriguez. So you take the brusho and you do circle O's. Comprendo?
So what do you do if you don't know what language your patient is speaking?
Mr. Young, how you doing today?
Khỏe, cho con khỏe không? Trời ơi, con răng con đau quá.
Remember, the universal expression is a smile.